Welcome back to Montgomery Heart Wellness, and here we are after a busy clinic on a Friday afternoon, and we saw lots of patients with very interesting and complex problems. And we're going to talk to you today about two patients with similar issues. They both have heart failure and issues with blood clots. Heart failure and blood clots are two conditions separately can cause a major threat to your health or even threaten your life. And when these conditions are combined, they can cause even worse problems. So stay tuned and see how we evaluate these patients, and we'll share our thoughts with you next. So as I said, we're here at the clinic and we're dealing with lots of patient complex issues, and today we're going to talk about two patients with heart failure and blood clots. Who's the first patient, Camille?
Her name will call Miss OA. She's a 53-year-old female. She has a long history of hypertension and diabetes. She had breast cancer treated with chemotherapy and a mastectomy in 2001. And then in 2008, she was diagnosed with heart failure after giving birth. And they believed the heart failure could have been also heavily due to damage over time, like late toxic effects from the chemotherapy agents, because she was on 3 of those for a few years. So she had moved to Houston from out of state, wanted to find a new cardiologist and learn what she could do more naturally to improve her health condition. She would get out of breath with exertion sometimes at her job, and she wanted to stick around for her children. She enjoyed her work, improve her health, but she struggled because sometimes these higher doses of these standard heart failure medications would cause her to not feel well and cause some side effects. During her testing today, we saw the pumping of the heart was quite weak, less than 20%, and we saw like a blood clot forming and then inferior vena cava, a major vessel going to the heart.
So, it's interesting. Very unfortunate. First of all, it's a young person. 53 is very young. Even at that age, she has a lot of chronic problems. But if you just back up and think about what's going on with her, a history of diabetes and high blood pressure, then of course the diagnosis of cancer, then of course the heart failure after the cancer treatment. At first glance, at first, impression, you say, well, this patient has a lot of complex medical problems. But again, as we always say, we like to try to think of the foundation of these problems. And one thing I want to emphasize is that a medical diagnosis in and of itself is not the underlying problem, probably in most cases. So for example, if someone diagnosed you with hypertension or high blood pressure, that's more of a manifestation of some underlying problem. Or diabetes, a manifestation of some underlying problem. Or even cancer is a manifestation of some underlying problem, similarly to heart failure. So if we take these different diagnostic labels, if you will, and say that these are just different manifestations of an underlying problem, then we can look at that medical history of diabetes, high blood pressure, cancer, then treatment for cancer, then heart failure. We can think of it as sort of one problem that's progressing over time. Now, even though the cancer was diagnosed and treated per se, the treatment probably only treated the manifestation, but not necessarily the underlying problem. And so if you only treat the manifestation, it's only covering up something and not really eradicating something. So the underlying problem continue to progress. That's one. Two, the treatment itself may also contribute to the underlying problem. Now, most individuals with chronic illnesses have one of several underlying problems, and most times they're all working together. One underlying problem is inflammation. Another underlying problem is increased oxidative stress, which is increased toxic chemicals. We call them free radicals in medicine, but increased toxicity in the body. The third one is an abnormal or disruptive microbiome. Your gut is disrupted and not healed. So we go back in this inflammatory process, dysbiosis process, increased oxidative stress process is getting worse over time, you're having different manifestation of this underlying process. So now she comes and she has worsening heart failure, in part due to the underlying process, probably part due to the treatment of one of the underlying process, one of the diagnoses. And then she also has a new problem, which would appear to be a blood clot. Now, clotting is something that happens when your body clots inappropriately. The body's getting signals of some kind of a damage, some kind of an injury, in which case it uses the same chemical markers that you see in increased inflammation to signal the body to form clots. So underlying inflammation is probably contributing to the clotting. So if we think of her set of diagnoses in that regard, then we say, well, why don't we cut to the underlying processes and address those things, and the manifestations will likely subside or be better controlled. When listening to you discuss her condition, I think our approach with her, what tests did we get? We got blood work and
we did
echo and
the ultrasounds, lots of, like you said, inflammatory markers, looking at stress in the blood vessels, especially, or screening for like autoimmune and screening for lots of causes of the inflammation. And we know that there's areas of her diet to work on and improve, which she was really interested in doing.
So the approach we will take, as Camille said, and then the echo you said showed the heart to be very weak. There was also fluid around the heart called pericardial effusion, which could be a pericarditis, and it's inflammation around the heart. So there's evidence of systemic inflammation, which is associated with increased oxidative stress. So our approach with the nutrition level is going to be an aggressive anti-inflammatory, anti-oxidative nutritional regimen. Once we get some of our blood tests, we'll then do some targeted micronutrient supplementations. We can also do things like infrared sauna, which has an anti-inflammatory effect, ozone therapy. So there are a lot of therapies we can use that has a very powerful anti-inflammatory effect. So it'll be interesting to see how she responds to this approach. I think that she's going to have a pretty good outcome if we're able to successfully reduce the inflammation, reduce oxidative stress, and we'll follow her very closely through the clinic. So stay tuned for Miss OA, because we'll give you follow-up on her, because I anticipate that she's going to respond quite well to this approach. So excellent the case presentation. Who's the other patient?
So this patient, his name is KD. He's a 50-year-old male. He was also diagnosed with heart failure. He was diagnosed with this in 2018. Prior to this, had long-standing hypertension, some high cholesterol. He had a stroke in 2024, but most recently, just in January, he had 2 strokes. So they found an acute embolic stroke affecting both the left and right side of the brain. They found a blood clot in the leg, blood clots in the lung. His heart failure was very bad. His ejection fraction was like 15%. And he informed me in the past they had ruled out blocked arteries as the cause. Nope. He didn't feel anybody told him what the cause was of the heart failure, was how he put it. And he was here because he knew he needed to make a change in his diet and to take more priority on his own health himself. He wanted to try to strengthen his heart. People had talked to him about a life vest, temporary and that kind of thing.
Wow. So again, another patient with heart failure and blood clots, but slightly different, type presentation. Some similarities: high blood pressure, an earlier presentation of heart failure, no cancer, but he has a greater history of blood clots. The first patient we talked about earlier had, a clot formed later in the manifestation. He had clots forming early in the manifestation. However, as we talked about with other patients, clotting can be a manifestation of underlying inflammation, increased oxidative stress. One person may manifest early as high blood pressure, diabetes. Someone else may manifest early as blood clot, high blood pressure, and earlier with heart failure. And I think that's the case with him. And interestingly, he has clots in the lower extremities, clots in the lungs. He may have had clots go from the right side of the heart to the left side. And you mentioned the phrase embolic stroke. Different types of strokes, 2 kinds. One is due to bleeding, one is due to clots. If you look at the ones due to clots, there are two kinds, subsets. One of the clot travels from one location to the brain. That's an embolism, so like the body's throwing a clot to the brain. And then the other clot is a clot that forms locally in the blood vessels. We call it a thrombotic stroke, or thrombosis formed locally. So a blood vessel gets damaged there in the brain, or ruptures, and a clot forms there. And then you can have bleeding, which is a hemorrhagic stroke. Sometimes you have bleeding after you have a clot. Sometimes the blood vessel gets damaged after a clot forms. So that's a post-embolic or post-thrombotic hemorrhagic. So
and he had some of that.
He had some of that.
Anyway.
Yeah. The underlying mechanisms are key in that you have a clot form remotely that goes to the brain, or clot form locally, or bleeding form locally. But guess what? All three are likely due to underlying inflammatory processes which cause increased clotting or increased damage to a blood vessel. So inflammation causes damage to a blood vessel, causes clotting. Inflammation causes clotting throughout the body to cause clots to move around, to embolize. And so we're still dealing with the underlying process of increased inflammation, increased oxidative stress, and likely an abnormal microbiome that sort of feeds into all these things. So there'll be a similar approach with dissipation in the sense that, we're going to address the inflammation, and we use that with a special targeted diet. Now, the nutritional interventions from one patient to the other may vary depending on their clinical condition. Some people may go more on an aggressive raw diet, some people on less. Some people may have more hydration. We may do targeted supplements, slightly different. But even though the approach we take is slightly different in nuance, the overall approach is very similar. And then we'll follow different tests with him as opposed to another patient that has other conditions. But what I want to emphasize is that we discussed two patients with heart failure and embolism. They're different manifestations in terms of how they presented clinically, but they have very similar underlying conditions, which I think is causing different manifestations, which I want to emphasize that we're all different genetically. And so we can all have the same underlying biological and biochemical abnormalities, but we'll all manifest different things. So somebody who is predisposed to having diabetes, if they have increased inflammation, increased oxidative stress, they'll get diabetes. So there's a propensity for cancer, but the underlying condition is oxidative stress, inflammation, abnormal microbiome, which is brought on by an abnormal environmental insult. Oftentimes the bad food we eat, or the lack of good food we eat, but the bad air we breathe, the water, and other toxins that may get into our system by other mechanisms. So we look at these things and we try to cut it off at the source. So again, I think he's going to respond quite well to the regimen that we start him on. I look forward to seeing his follow-up. So I hope this was helpful. I always want to emphasize that we like to think of the underlying condition, which is not necessarily the diagnostic label. So if your doctor gives you a diagnostic label, ask her or him, what did they think the underlying cause or underlying mechanism is, and think of how that's going to be addressed. So if you have any questions or comments, leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our